I would like to ask Arzu if you knew all these techniques when you were struggling these 11 months when you couldn't go to a specialist. Maybe these tools could help you at least soothe your body and mind a bit. And maybe you could get some relief. Of course, as Shiria already mentioned, we are not expecting these measures to cure chronic urticaria, but we know that when the patients have more stress, then they have more urticaria. So calming down the stress also helps with the severity and activity of the disease, and I think these can be really helpful. So anything you want to mention or comment? First, I would like to give the microphone to all of you. If you have any other comments and want to say a few words about our webinar, just feel free to add any comments. And I am checking if there are any questions. Anna already. Okay, so Daria joined. Hector Ratti asked a question to Anna and asked, of course, how do you make all these patient-reported outcome measures filled in when you have only 5-10 minutes for a patient? Of course, it's not easy, but Anna answered that she's sparing 29 minutes for every patient. It's luxury, or yes, it's not possible in every setting for sure. And Rabia also messaged, thank you so much for the fantastic and especially Shiria's interesting presentations. Never give up. Yes, we never give up, and our patients also never give up. They even came to Global Urticaria Forum. Congratulations, Arzu. I'm so impressed by this. So nice. So, okay, then, yes, Shiria already mentioned, but Anna, do you think stress, which is first, stress or urticaria or stress? What do you think?
I think that, it's asking of the head, egg or hen. So actually, it's physiology. Stress is taking us out of the balance, but stress is progress as well. So we actually evaluate. If it's too much, it's too much. So I think that it's so interconnected, everything, that we should, and everybody has a different threshold. Somebody cannot even notice something, but another person, very sensitive, could already trigger, as Shia said, or our stress loops, okay, sympathetic and HPA. So here you are. But, it's life. So I think communication, support group, and actually using this marvelous techniques that Shia said, not invasive, to help to balance nervous and immunological system, and of course, the whole body. And that's it. Life is life, day after day. What can we say?
Yes, wonderful. Arzu, I just pointed out a word that you used when you were communicating with your doctor, that you said you had to self-advocate your care. I find it very, summary of a situation happening between patient and the physician, but I like the phrase. And would you like to comment more on that?
Yeah, thank you so much, Amek and Shreya and Professor Anna as well. It's been so great to hear such different approaches to how it is that patients can feel empowered and equipped to navigate some of their challenges day to day. Self-advocacy, really, it comes down to no one's going to fight for you. You have to fight for yourself. And unfortunately, urticaria is one of those conditions that I think, at least at that kind of general doctor level, is not very well known beyond, this is the presentation and this is how you might treat it. I don't think they really understand the depth of the condition, the complexity of it, and the multifaceted nature and how it might impact you as a patient and your life. So when you are faced with having to go through that front line of healthcare professional to then be able to get to the specialist, because I don't have the power to get straight to a specialist, you have to go through the system in the way that it's set up, then I think you have to take ownership of your own condition. And in some cases, you almost have to know more than your doctor in order to be able to use that self-advocacy approach to effectively get what you need. And it can be really frustrating. I remember weeks and months where every week I was talking to a different doctor, because you're never guaranteed an appointment with the same doctor you spoke to before. So having to repeat and go through everything again from beginning to end is very exhausting. But you again have to find some very deep resilience within you to be able to know that this is for yourself, and you have the power, the greatest power, to be able to push your cause forward in that sense. And I'd really encourage patients to feel that they can challenge their doctors more as well, because often I think people give up a bit too easily once the doctor has told them something, but there's usually more to the story. So, I mean, that just describes the approach that I took. It may not work for everyone, but it definitely helped me get through the last couple of years.
Thanks for sharing this experience. So there are also a few questions here I see from EH. Sorry, your name is not seen here on the EH initials. So she's asking any insights on mental health and menstrual cycle in women. Any links with flare-ups, stress, and PMS? Do you want to answer? I know the hormonal side a bit. We know that we did a study and 15% of the patients were reporting that their urticaria is flaring up before menstruation. So with the PMS, they have flare-ups. And we also know that many patients report that their urticaria is going wild when they are having stress. For example, discussions at home or stress in work usually really aggravates urticaria. We are very much aware of that. Do you want to add something in, Shreya? Maybe you want to, I think you raised your hand, or?
That I wanted to ask Arzu, but I'll just get to this first. Anecdotally, I think women do feel under more like a pressure of sorts when, premenstrually or menstrually, there seems to be a little bit of that brain fog also that sets in, which I think also hampers their ability to deal with the urticaria. So I am not sure if it objectively gets worse, like, do 10 hives become 20? I'm not sure, but I do know that women find it harder to deal with the hives at that point. May I ask Arzu a question, if that's okay?
Sorry, Shreya, before you come in, can I just share something about my experience during the menstruation periods? I actually found that 1 week in the month was when my hives actually calmed down, and I never got down to the bottom of why, but it was very consistent that every month when I was on my period, my flare-ups would go completely calm. So that's I've not got back down to the bottom of why.
So during the menstruation, you mean it was
Yeah.
calming down?
Yeah. That was the best
Yes.
time in the month for my skin. Yeah.
Yes, this can.
I guess it needs more research, right?
Yes, of course. This is an open area, and it's really, I think it's interesting, very interesting and important. So anything, Shreya, I think you were saying something else, or?
Yes, I just wanted
There
to
is-
ask you, Arzu, would you have appreciated a referral to a psychologist when you were going through this? Do you think that might have been something that could have been helpful to you? And I wonder, were you resting more on during the days of your period? Is it by any chance possible that you were taking it a little easier during those days every month?
I think I just start with your second question first. I don't think I was resting more in that period. But I would, like, my routine is fairly similar most days. It's just work. Like a lot of it is work or getting out for walks and seeing family. So I don't think there was much difference in my lifestyle during those weeks, but it was very consistent that whenever I had my period, the hives would just calm down. But your former question, interestingly, in kind of those initial 9 months of talking to my doctor, nobody ever asked me about how is your mental health or what are you feeling or how do you feel you're coping with what you're going through. I don't think I was in a good place, and maybe it would have helped to have spoken to someone who was well equipped to help me think about those things, because I was focusing so much on what the physical experience of my condition was that, to be honest, I knew that I was experiencing lots of other emotions and feelings and thoughts, but I didn't really focus on them because no one really triggered the thought. And I kind of, generally, I think in terms of my mindset is very much of get on with things rather than like stop and reflect and process the emotion. So actually today when I made my notes for the webinar and I read through them to my friend, I actually cried through the whole thing because maybe I'm still processing a lot of what has happened in the last few years now, because I don't think I really did it at the time. So yeah, I think it would have been helpful if that was part of the initial triaging.
I think there was somebody who asked Professor Anna how to fit it in 5-10 minutes. I know it's not always possible, but I think maybe 20 seconds to ask, are you stressed? And just to get a yes or no and maybe carry it forward or refer it, maybe that's a place to start.
Yes, I find this question also very helpful, and they always have a lot to tell, but I don't know if it's good to ask or not, because when your time is limited, then you also struggle as a physician afterwards. Okay, then now our time is already 15 minutes. We exceeded. So, dear friends, dear colleagues, thanks a lot for your wonderful presentations and your contributions, Arzu, especially you. This is so vulnerable, and you really took the stage for us, and that was wonderful. Thanks for sharing all your experience. So now I have to open this outro slide, and please share your comments, opinions about our webinar. Did you like it? Do you want us to do better? Please comment. And also, I would like to invite you to the next webinar that will take place on the 19th of November. It will be about clinical trials and urticaria patients. You can learn more about how to participate in a clinical trial as a patient. And please give us feedback on our webinar. Did we do good or bad? What do you think? Please fill in the form and stay connected with the UCARE for you. Here are our social media sites. Please follow us and also share this information. And so I would like to thank our sponsors and everybody participating and all our speakers. That was a wonderful webinar. I learned a lot, and I feel good that we did it. Thanks a lot, and have a nice day.